Hey everybody, this is Dr. Lee from Lee Acupuncture. And as I said, I am so honored to have this special guest, Dr. Kelly Back. Hi,
Oh, thank
Doc.
you so much, Dr. Lee, for having me. I'm like really excited to have this opportunity to speak to our mutual patients and all of your clients. So thank you.
Amazing. So let me explain who she is. So Dr. Kelly Back is world-renowned fertility specialist and then partner at California Fertility Partners. Dr. Baek is a double board certified in both reproductive endocrinology and infertility, and then obstetrics and gynecology. And Los Angeles native, she graduated from the honors from Johns Hopkins University and earned her medical degree from the Mount Sinai School of Medicine. And let's see, in New York. So she completed her residency in obstetrics and gynecology at the New York University Langone Medical Center and her postdoctoral fellowship training in reproductive endocrinology and then infertility at the New York Presbyterian Weill Cornell Medical Center. She is recognized as one of the Los Angeles Magazine's top doctors and Southern California the super doctors. Dr. Baek was featured in the 2019 Vogue article, How California Became the World's Fertility Treatment Destination, and in the Netflix series, Ring Empire. Hi, Dad.
Hi, how are you?
Yeah, whenever I talk to Dr. Beck, everybody said, Ring Empire.
Oh, that's right. Oh,
Amazing. So I know you're busy, so let's start. So can you tell us about your practice, Doc?
sure. So our practice, Richard Mars and Guy Ringler, Richard Mars is responsible for the first frozen embryo baby in the United States. Founded the practice over 35 years ago. And my other partner, Guy Ringler, is one of the original pioneers of third party, which is egg donor and surrogacy and gay family building. And so when I joined the practice over 11 years ago from New York, after being in practice in New York and New Jersey, I brought the egg freeze program there. And so we have a clientele that's about 50% are international. And so our patients all come from word of mouth. They come from either former patients, family members, or friends. And so it's a very hands-on, high-touch practice where we all work 7 days a week. We have a new partner, Dr. Corinne Chung, who was at USC for over 14 years, and she was the head of the oncofertility and the egg freeze department there at USC. And so we're really excited to have her as your new partner. But it's one of our centers. What's really nice is that we're one of the few centers where you always see your own doctors for every ultrasound. And so we really believe that, it's so important to personalize and individualize fertility care. So that's why we all work 7 days a week.
I mean, when I went to your center, absolutely it's so warming and then a beautiful place and everything very hands-on, personalized, I can tell you. And when I heard about you, you said that you also have some like a fertility challenge, but also can you share what made you to focus on this infertility field?
Sure. So when I was a resident at NYU, I had no idea about this field. And I was really fortunate when I was doing my residency that at NYU, they have one of the top IVF centers in New York City. And so we did a rotation during my residency. And what was great is that when I went through the fertility center, I really identified with all the patients there. Like, this is me, women who are delaying having children in order to have a career. You don't want to put your career on hold or jeopardize, climbing up in order to have, to have a family. And I think what was really interesting for me, and I think one of the reasons I personalized it, is having delayed having children myself in order to do my residency and fellowship. I personally also needed IVF, and so I have IVF twins. And so having gone through the process myself, I think it helps me identify what patients are going through, but it also makes me much more, I think, apt to being a diagnostic in terms of trying to figure out what are the reasons why someone's having challenges. I find that oftentimes, instead of just treating you right away with whether it's an IUI or IVF, we're really trying to figure out like what are the potential issues that are going on? Can we potentially improve sperm quality? Is there an ovulatory dysfunction? Can we increase ovarian activity? Is there a hormonal imbalance? By addressing these underlying questions, I really believe you can optimize success and many times perhaps not need IVF if you can correct the underlying causes.
Wow. So you are conventional full scope of IUI, I mean the IVF doctor, but you actually more integrative and then more holistic approach is you are adding up at this time. I think
Yeah,
that's
so I think Dr. Lee, this is why you and I met. And one of the reasons we met is because, I really believe in this holistic with the W approach to fertility. So if I meet someone where I feel like they can have a better ovarian activity before we proceed with any type of treatment, even if they're doing egg freezing, I really have them try to make some lifestyle changes. I think that, what time you go to bed, the quality of sleep, the diet you're having, your exercise, and also if you're working with acupuncturists and herbalists who really this is all they do. So you can't go to the acupuncturist who helps you with your neck or back pain, but it has to be someone who really specializes just in fertility. In the same way you wouldn't do IVF with an OBGYN, you really need to go to a fertility specialist who specializes in fertility for acupuncture as well. And so this is why I really try to have them work with, you, especially when they're in Orange County, for 2 to 3 months before we proceed with anything. And I oftentimes find that patients have a higher activity, they require less medication, and overall just have an easier cycle when we're doing, whether it's IVF or egg freezing, and even when we're doing an IUI.
amazing, amazing. Truly appreciate it. So you actually saw this so many patients. So in your experience, so what you've been seeing like a biggest struggle that many patients experiencing with this infertility specific?
I think the biggest struggles are, I think a lot of misunderstandings, and there's a lot of false information on the internet. So people read the internet and they think everything applies to them, or because their best friend has their exact same lifestyle or they're the same age, they must have the same issues. And why, if this works for their best friend, why doesn't it work for me? And I really try to tell patients that everyone is so different. You could be the exact same age, you could go to the same school, you could live in the same neighborhood, but things are very different. So we really have to individualize it. We also have to really think about, what are our goals? And so I think a lot of times on the internet, there's a certain thing where, it seems like there's a cookie cutter, like, oh, if you want to work on egg quality, these are the vitamins you need to take. And that's not really true for everyone. So I think that this like cookie cutter, one size fits all just does not work. There's no real magic with what we do. So you really have to individualize it. And that's why I think that it's so important that when you want to just assess your fertility, it's really a good idea, just even if you're not going to do treatment, get an accurate assessment so you know what your own ovarian reserve is. You can't go by a blood test. There's also a blood test called an AMH, which Dr. Lee, I know you know well. And people have this false idea that, oh my gosh, if I'm young and I have a low AMH, I'm not going to have a baby. And that's just not true. When you have a lower AMH, it does not mean you're not going to have a baby. It does not mean you need to rush into IVF or you're not going to have a genetic child. It just means for some reason you have a lower number of eggs for your age, but it does not mean you're not going to have a child. So I think that a lot of times people are focused on blood tests without really understanding what is the clinical meaning behind it.
I am very sure there's so many women hearing what you say and they feel so much relief because that's what the AMH, suddenly they just label themselves in photo in some way. And then
right. I mean, you and I have seen this together where we have patients where they're so panicked and their AMH is low and they're like, why can't I do IVF like tomorrow? And, when you have to try to say, okay, well, this is why. If your AMH is lower, let's try to figure out what could be contributing to this. Do you have a history of an infection? Do you have a chronic illness or an autoimmune issue? Or do you have a history of smoking? Or, do you vape currently? Do you have a history of an eating disorder? Do you have a genetic disorder? Or were you just simply born with a lower number? And obviously 1 in 10 women have endometriosis that can also age your ovaries. But even when you have a lower AMH, if you work with an acupuncturist, make some lifestyle changes, do certain supplements that are appropriate for you, you can certainly have increased ovarian activity that whatever you decide to do, whether it's egg freezing or just simply monitor your own ovarian assessment, it's really important to maintain that fertility throughout until you're ready to have children. And so you don't really need to see me. Maybe you'll just work with your acupuncturist until you're ready.
You're just amazing. So you somehow integrate a lot of alternative medicine or other like acupuncture, but also I heard that you are referring some patient for clinical psychologist as well. So you are helping patients with this mind-body connection as well?
Absolutely. So if you think about us, our bodies and our mind, everything is connected. If to think about your normal menstrual cycle, when you're under stress, you're getting married, you're buying a house, you have an exam, we've all experienced that our menstrual cycles can be irregular. So that's just a kind of a simple example of how, like one example of how you can see how your stress and what your mind is going through can affect your ovulation. So obviously, if you're always going through the stressor period, you can see how that can shut your ovaries down, and more importantly, monitor, it can prevent normal ovulation. I have a lot of women who believe that just because they get their period every month that they're ovulating properly, and that's not true. Or because they see an ovulation predictor kit that says they're positive, great, you're ovulating, but are you ovulating at a good size? Some women naturally ovulate at a larger size. So yes, they're ovulating, but are they ovulating at a good size? Why is that important? If you're naturally ovulating at a larger size, the problem with that, and we know this from our IVF data, is that you're naturally ovulating an overcooked egg. And if you're ovulating an overcooked egg, it's really hard to get pregnant because more likely that embryo will not be genetically normal, and it's an easy fix. So that's why, the mind body to me is really important. I also find that, fertility or even thinking about fertility or being single and going through this alone can be stressful. So I think having that support system is really important. If you're thinking about using an egg donor or sperm donor or surrogacy, it's also really important to think about, is this really something you're comfortable with? So I always want to make sure that before anyone goes through any type of treatment, they really think about it. Like, am I comfortable with this? Because if you're not, you don't want to go through a treatment and then find out, oh my gosh, I don't want to have a child with donor sperm. So I think it's really important to think about it before you do anything. And you also have to think about if you use donor gametes or you use a surrogate or you decide to do this on your own, you have to think about, how am I going to tell my child in the future? And that's a big question that I get. So, I think it's like comprehensive in terms of not just for the immediate moment of having someone support you through the process, helping you with your mind, body, relaxation, meditation. But I also think that sometimes it's just nice to have guidance and someone who all they do is think about fertility. They may help you think about or vet questions you've never even thought about. Like, don't you agree, as an acupuncturist, when you're doing acupuncture, you must be talking to your patients during that time where they're probably going to tell you things that, because they have that extended time with you, they may bring things up, and I'm sure you provide that same support, because I know my patients who have seen you have always found it very comforting that you will bring or highlight something that they knew, but you really highlight it again so they really hear it.
Absolutely. Traditional medicine and then all those integrative approach, because the fundamental question I think we should have, not only are you ready for this, but why are you doing this? Sometimes
Exactly.
they do that they don't really know why they do, maybe my age or my family, my spouse. So I think that's very important support you are providing for patients. I appreciate that.
But I think the other thing is sometimes people feel like they're broken. They feel like, oh my gosh, why do I need treatment? Why isn't this happening naturally? Everyone thinks that this should just be a given. That's not really true. So you have to really think about it. So you wouldn't say that if someone was diabetic or had high blood pressure, you wouldn't say, oh, you're a broken person. But I think the other thing to think about is there are only certain things that the mind, body, acupuncture, and doing things naturally, there's a limitation. If there is, something like physically wrong, an anatomic defect, your tubes are blocked, you're born with a urine defect, you have scar tissue, sometimes, of course, you need treatment or you need surgery or you need intervention. But, those are the things where you have to understand what are the limitations of the mind, body, the alternative therapies, but you also have to know there's a role for, intervention, whether it's IVF or surgery or an IUI.
Absolutely. It was to be all combined.
Right.
So I'm following your Instagram a lot. I think, and then now somehow I think egg freezing or it's very popular. We have a single want to have a family in future. So when I watch your Instagram, you have some certain sync, and then can you share some your secret way of looking at the egg freezing to be more successful, like outcome wise, or what you're looking into?
Sure. So the first thing I want to say before we start that part is that I don't believe that everyone is a candidate for egg freezing. People think that when they come in for an egg freezing appointment that they're ordering a sandwich and like, oh, I want to freeze my eggs. Well, I think you have to first find out, is it appropriate for you? What are your goals, your fertility goals, and is this appropriate for you? So if you are, unlike men who are always making new sperm, we're born with a finite number of eggs. And for women, if we have a lower number of eggs for our age or a really low number, maybe this isn't the best thing, because with egg freezing, it's different than an embryo where we don't know how will it thaw, will it fertilize normally, and will it be genetically normal. When you're younger, under the age of 35, 50% of your eggs are normal, so you can freeze a lower number of eggs and have a very high success rate for a live birth. When you're older, egg freezing, unless you're an outlier and you have a lot of eggs, it may not be the appropriate thing for you. And at that situation, I will always bring up the idea of maybe just conceiving naturally because they're not infertile, or consider creating an embryo over an egg because we know it fertilizes normally and is genetically normal. And so it gives you a much more reliable chance. But whenever I do egg freezing, I try to monitor a natural cycle to figure out how does this person ovulate? Do they ovulate properly? I try to start some, coenzyme Q10 if they have a lower number of eggs, acupuncture, make sure they're sleeping well, they're avoiding any pot or cigarettes or high intensity workouts. And then after ovulation, I always take a look. So the big thing about synchronizing follicles is I try really hard to avoid birth control pills. The thing with birth control pills, it's really easy to synchronize people. If you put people on birth control pills for an extended period of time, you'll get the follicles together. What happens in a natural cycle? In a natural cycle, from a group of eggs, one will grow, one will ovulate, you lose all those eggs. When you're doing egg freezing, you want all the eggs to be similar in size so they have the best chance of growing together because only mature eggs can be frozen. When you use birth control pills, sure, they all look similar in size, but there's also a suppressive component of the birth control pills. So that's why I try to avoid birth control pills. Right after ovulation, even before your period begins, you get to see the follicles for the following month. And that's when I take a look at a woman. So I first ensure they're ovulating properly. 4 to 5 days after ovulation, I do an ultrasound and I confirm, did you ovulate properly? How many follicles do you have for the next month? Are they similar in size? If they're very similar in size, at that point, I'll consider using estrogen. And the reason for using estrogen is to prevent the early rise in the follicle stimulating hormone, so your follicles all stay similar. And by doing that, you're not suppressing your ovaries in any way, you're just keeping them together. So when they start their cycle, they'll maximize the number of eggs they have to work with, and they have the best chance of your eggs growing together to maximize yield in one cycle.
Wow. It's a lot of things involved, and thank you so much for the detailed information. So the one thing also we are even I'm saying a time is not only the factor, but it's actually the most important factor. So we don't want to make any mistake in this fertility journey and successful as possible earliest. So can you share what people actually make a mistake in this fertility journey?
I think one of the biggest mistakes that people, I see happening is sometimes they have their own timeline and they don't listen to what their body's timeline is. Oh. So they want to do an egg freeze or an IVF cycle by March because that's the best time, and they want to go on vacation in April, so they want to do it in March. But really, I always tell women, you may want to do it in March, but that may not be the best month for you. So when women or anyone, they try to create their own unnatural timeline and they don't really listen to what their body is doing, I think that's one of the biggest mistakes where you don't have the best cycle you could have. The second thing that I sometimes see is when people are rushing into treatment and they're ignoring all the signs of all the things they can do to make their cycle more successful, whether improving sperm quality, avoiding, making those lifestyle changes. If the sperm is compromised and someone is trying to conceive with a partner, or, I always say the life cycle of sperm is 2 to 3 months. We have to be patient. We have to wait at least 2 to 3 months to make it better. So I think that's the second mistake that I oftentimes see, is when people are just rushing through. And the third is when you think about, there are certain centers where you can freeze your eggs and it's great and it seems cost effective, but you're not having a fertility specialist. Like, to be a fertility specialist is board certified or double board certified. We do a fellowship, which, accredited fellowship after doing an OBGYN residency, but there are a lot of people who haven't done a fellowship who are accredited who are doing this now, and they're offering it for a lot less. And so that's the other things. You really have to make sure you do the research, you make sure who is this person, not just because they have great marketing or they have, pretty signs and they're on Instagram, but you really want to make sure you do your due diligence, check that they're double board certified, and you also want to make sure that they truly did a fellowship.
Amazing. So to listen your body's time, and then so that you also have the right choice, and then be patient. Sometimes it can be a little bit anxious. I totally agree.
I mean,
So,
don't you agree with that? That has to be your approach too. Like, what do you think are the
absolutely. Because I said, give us 3 months, and we can make it. But patients very anxious. Sometimes actually, I noticed their doctors anxious too, though.
Right.
Unfortunately, their doctor, they don't want them to wait. So that's sometimes the barrier I have to go through it. So I appreciate your support. And so, is it anything like because I know you're so busy, doc, is there anything you want to share with our audience and the patients of your insight?
You know, I don't think I have anything to share except for, I think for me, the biggest thing is a lot of times, even if you're not ready to do a fertility treatment, just because you meet with a fertility specialist, it doesn't mean that you're going to do treatment or you're bound to do anything. But I do think every woman should get an assessment just to know where they stand. I can't look at, 5 30-year-old women and know that all 5 of them are going to have healthy ovaries and everything is perfectly fine and they're not going to have difficulty. But I think having an accurate assessment is a really key part. I think that there's no blood test that can do this. So you really need a comprehensive overview to make sure that there's no lifestyle things that you're doing that, that you're hurting yourself. A lot of times after the fact, I have patients where they'll say, oh, I wish I had known that, smoking pot every day for a decade was really going to affect my fertility. I thought it was natural. So I think these are like basic things that we just take for granted that we don't know. And it's not because people don't want to know, because no one wants to harm themselves. They just don't know. So I do think that's kind of a basic thing that I'm advising everyone to get an assessment, even if you're not going to do treatment, just to know where you stand.
Exactly. That's actually, I'm hearing a lot for our patients saying, I wish I knew this a little earlier.
Right.
Absolutely. So can you share how people can find you and your practice staff?
Yeah, everyone finds me, most of my patients find me on Instagram or just on Googling me and finding me on our website, which is California Fertility Partners. But, I think for me, the reason I have my Instagram isn't because I'm really trying to market myself for more patients. I really try to provide information that I think I'm trying to make sure people get the right information, because not everyone is able to come to Los Angeles or have access to it. Not everyone has access to, this type of information. And there's a lot of false information on the internet that have their own agenda. So we have to be really careful what we're reading. But, I really appreciate working with you, Dr. Lee, because it's really great having someone that I trust care for my patients. So thank you.
Thank you so much. I appreciate that. Thank you. Truly, I appreciate it. You're just amazing and so open-minded. It's my honor. Thank you so much, Doc.
Okay, thank you.
Yeah.